Welcome to Radi Us, our University of Manitoba Radi Faculty of Health Sciences monthly podcast, where you get to catch up on the headlines from the past month and meet our faculty, staff, and learners making news. We'll also be engaging with our Radi community beyond our UM campuses, so be sure to listen for alumni and partner voices too. The Roundup for the month of June 2025 includes stories about a life-changing jaw surgery, a new Indigenous Rehabilitation Sciences initiative, and the Manitoba Student Health Research Forum, and more. I'm Jonathan Wilson from the Radi Faculty Communications and Marketing team. The spread of uncontrolled wildfires has caused significant destruction and evacuations of communities across Manitoba this summer. With over 100 active wildfires in the province as of July 10th, it doesn't show any sign of slowing down. One of the other negative effects of the wildfires is the constant lingering smoke that can pose health risks, especially to those with health conditions that make them more vulnerable. Dr. Andrew Haleko is a research scientist and professor in the Max Rady College of Medicine and a Canada Research Chair in Lung Pathobiology and Treatment. We spoke with Dr. Haleko about what exactly are the harmful chemicals contained in wildfire smoke and who is most at risk.
Ultrafine particles. These are actually made from very tiny soot particles that come off of when you burn wood. Those can be inhaled deep into the lung. And so they become problematic because now we respond to them as essentially a foreign object that we've inhaled. They also contain other toxicants or chemicals, including polyaromatic hydrocarbons, also known as PAHs, as well as volatile organic compounds. The vulnerability comes to the general population, but more so to individuals that have an underlying chronic disease like asthma or chronic obstructive pulmonary disease, where one of the features is persistent lung inflammation.
Dr. Haleko said there are a few ways to mitigate the danger when significant wildfire smoke is present.
First amongst those would be for you to consider wearing an N95 mask. The other thing you can do, particularly when the air is bad and you are in a vulnerable population, is stay inside, seal the windows of your house. The last thing you can do is you can either purchase a commercial air filter, HEPA, containing a HEPA filter, or you can actually make your own. If you go to the Manitoba Lung Association website, for example, they tell you how to get a cheap box fan and a furnace filter, and you can make your own HEPA filter for your house.
A car accident in 2013 damaged Kendra Finley's jaw, leaving her in unbearable pain. For more than 10 years, she could only eat soft food and often woke up in the middle of the night in distress. Talking caused a sharp pain, and she avoided conversations that lasted more than a minute.
But it was, excruciating. It was, because it was just bone on bone. Every time I opened and closed my mouth, and there was no cartilage, no nothing in there, and it was breaking down. The bone was breaking down.
Finley underwent multiple treatments and 4 surgeries to treat progressive degenerative joint disease, a chronic condition where bone and cartilage in the jaw joint degrade over time. But nothing worked to ease the pain. So Dr. Adnan Shah, Department Head of Dental and Diagnostic and Surgical Sciences at the Dr. Gerald Nisnik College of Dentistry, decided the last resort was jaw joint replacement surgery. At the Health Science Center in April 2024, Shaw and his team of residents performed the first jaw joint replacement surgery to take place in Manitoba.
Take the diseased part of the joint out and place the implants which were tested before on the bottles to fit it in the right joint space. So it reconstructs the part of the jawbone and reconstructs the joint itself.
1 year later, Finley is pain-free with normal jaw function. She no longer takes pain medication, she can smile in photos again, and can carry on long conversations.
It is like night and day. I don't even know how to, it's so hard to explain. It is, I can eat food. I can actually have a hamburger, no pain, no cracking, Nothing.
Shaw believes that because the jaw is such an important part of the body, this surgery should be as routine in the province as replacing a knee or hip. Drumming and singing filled the Brodie Centre atrium on June 20th as the Rady Faculty of Health Sciences community gathered to celebrate National Indigenous Peoples Day. The day's events were hosted by Ngomazin, Indigenous Institute of Health and Healing in the Rady faculty. 3 dancers performed different dance styles, including the Prairie Chicken Dance, Jingle Dress, and Woodland Strap Dress. They shared the stage with the Sons of the Drum Group. The event was emceed by Deborah Beach Ducharme, whose spirit name is Earthwoman. She is the Director of Indigenous Health Integration at Ngomazin Education. She told the audience that Indigenous people come from deep roots.
Roots that connect us to the land, to our languages, and to the songs of our ancestors. From those roots we rise. Our resilience is powerful, and it's the way we dance, the way we speak our languages, the way we gather in community and lift each other up.
George Muswagon, knowledge keeper with Ngomazin, addressed the audience and said that the Indigenous culture shared that day is just a glimpse into it.
When we do pipe and when we do the fire outside, these are small windows into our ceremony. There's much more to it than just that. There's much preparation that happens. Take a look at the regalia. If you can only imagine the amount of hours it takes to prepare those. Think about that for a second.
Following the event in Brodie Centre, the audience enjoyed a feast catered by Shelley's Indigenous Bistro. Vendors were also set up to sell their handmade products. The morning began with a lighting of a sacred fire and pipe ceremony at Mashkiki Gitigan Medicine Garden. A new initiative to promote careers in rehabilitation sciences to youth in First Nations communities in Manitoba was launched on May 26th. The initiative, a partnership between the College of Rehabilitation Sciences and 9 First Nations communities, is called Grow Our Own Specialists Through Education, or GOOSE. The program aims to address the shortage of rehabilitation healthcare professionals in Manitoba's north, as well as the overall underrepresentation of Indigenous people in the profession. Marlene Head, post-secondary supervisor at Opaskwayak Cree Nation, was one of the initial visionaries of GOOSE. She said it began by supporting teachers to further their education master's degree programs in rehabilitation sciences. Recently, thanks to $1.5 million in funding from the through a partnership with the MasterCard Foundation's ELEV program, the program now promotes rehabilitation careers to students in grade 7.
So now we're able to work with the communities and then focus on student events and activities and any way we can to lead them and guide them towards these programs that we need in our communities and the specialists. And by doing that, now we can do things like STEM camps and tours of the facilities and just overall promoting the youth to think about these careers, because we're not always promoted at career fairs. So now we can do that, and we can do more with the youth now with the funding.
Margaret Hart, Indigenous scholar in the College of Rehabilitation Sciences, is UM's community facilitator for the initiative. She said GOOSE will help prepare culturally safe practitioners to address health inequities among Indigenous people. More than 250 students from across Manitoba gathered at UM's Bannatyne campus this June for the Manitoba Student Health Research Forum. Over 3 days, students showcased their work, networked with professionals, and competed for more than $53,000 in awards and travel grants. Dr. Samantha Pauls, assistant professor at the College of Pharmacy and chair of the forum, said the event is about celebrating Manitoba's health research community.
This event started over 35 years ago by Dr. Ed Krager. It was called something else. It went through various name changes, but we kind of refer to it affectionately as Research Days. And it was always an opportunity to kind of pull together the kind of medical research community And now we've kind of expanded that to broader health research community. And it's always been very student focused on giving them opportunities for, training, networking, and professional development, the opportunity to present their work and, potentially receive some early wins in their careers before they move on to present it at kind of larger forums across the country or across the world.
This year, 36 students received awards. Among them was Shitka Chattopadhyaya, a PhD candidate in physiology and pathophysiology at the Max Rady College of Medicine, who earned 3 major honors for her research into repurposing commonly prescribed medications to treat cardiac fibrosis.
Science can be bumpy. Sometimes we have like highs, then sometimes have like stretches of lows, right? So when things like these come, it's it's always like celebrate your successes, right? These are like the bright lights, the light towers that like keep us going in our research.
After several years of planning, a new community-led supported living complex in Sagkeeng First Nation welcomed its first residents in June. The 10-unit facility is located next to Sagkeeng Health Center and is designed to support adult community members living with disabilities and homelessness. The complex celebrated its grand opening with a ribbon-cutting ceremony on May 22nd, and the first residents moved in on June 15. The project is supported through a partnership between the College of Rehabilitation Sciences and over a dozen other Manitoba First Nations communities. The college helped develop the project and continues to support through several student initiatives, including the development of a day program for adults with disabilities and fundraising efforts. Braden Matheson was one of 6 occupational therapy students who worked with the project this year as part of a course on community engagement.
So we have been spending a lot of our time fundraising, and then the second part was to provide programming. So occupational therapists worked on this last year, students worked on it last year, and there'll be daily programming provided. And so our role is to kind of see what kind of resources the community has and what workers the community has available and who can provide this, and then from that, and also what the community interests are, and then from that creating programming that's going to help folks with like life skills and engagement.
Matheson said a key to the success of her group's work was the strong relationships that were established early on and the existing relationship between the community and course leader Margaret Hart.
And one of the first things that we did was we opened with ceremony. And one of our professors has a long-standing relationship with Sagkeeng, and I think that's a really important piece of the puzzle when we're talking about engaging with Indigenous communities. Like that relationship and the work before the work is really important. And so I feel really privileged and I think honored, it's probably speaking for the rest of my group as well, that we get to engage with this community that like already knows and loves and trusts Margaret. And opening in ceremony and saying like what our intentions are and who we are as people before we even start doing the work that they've asked us to do was a really important part of the process.
A new UM study is seeking Manitobans who have received cancer treatment over the past 10 years to take part in a survey about their physical rehabilitation needs. Previous studies indicated that most people living with cancer experience long-standing side effects, both from their cancer and related treatments. The study is led by Denise Drycleft, a physiotherapist and master's student at the College of Rehabilitation Sciences. Drycleft told CTV Winnipeg that while physical rehabilitation is an effective strategy to mitigate these side effects, there is a gap in awareness of these services.
Well, in order for us to address these needs and try to improve accessibility of cancer rehab and physical rehab for this, we need to better understand what those unmet needs are and what the barriers are for people to access rehab. We know previous studies have shown that a majority of people experiencing side effects don't actually seek help for their side effects or get referred to rehab. A lot of them are told it's just the new normal, and so they don't even know that there's help that exists. So we're trying to figure out what those barriers are, figuring out the different types of cancer that create different side effects and the needs. So a lot of studies also kind of focus specifically on that a certain number of cancer types. We're looking at all cancer types in this study, and so we're really trying to find out what those unmet needs are in Manitoba so that we can hopefully work on creating a better survivorship experience for people.
The web-based survey will be open until late July. Drycleft estimates it will take respondents 20 to 25 minutes to complete and says they can fill it out over more than one sitting. The link to the survey is available in our show notes. On Convocation Day in June, Deanna Garand proudly graduated as a nurse. The 32-year-old Red River Métis grad accepted her degree wearing a Métis sash and an Indigenous ribbon skirt. She credited the Pathway to Indigenous Nursing Education unit at the College of Nursing for connecting her with many forms of support during her studies. Known as PINE for short, the unit provides resources ranging from tutoring to spiritual care, helping Indigenous students reach their potential and graduate into nursing careers. Garand, who grew up disconnected from her Métis roots, told APTN National News that PINE helped her grow both academically and culturally.
It was just great to have all-around support and have access to elders. They really helped me reconnect because that was something that was important to me when I started my university journey because I didn't really grow up with much culture. So it was really, really helpful and gave me a place to feel like I belonged here.
Garand has started her nursing career with a job at an Indigenous-led community health center.
We need more Indigenous people in those places that are making decisions and more Indigenous people in those places that are working directly frontline. There is a community of Indigenous people here at the university that are so unbelievably supportive, and they really want to see that you make it through to the end.
Thanks for joining us today. Please send any ideas and feedback to radiemarketing@umanitoba.ca. Read more about this episode's stories by checking out the show notes or visiting our UM Today Radie Network news site at news.umanitoba.ca/network/Radie Faculty of Health Sciences.